Assalamu alaikum. Starting with the clinical case, Miss Mona, 35 years, with complaint of leg swelling.
Okay.
I will share the timer, then you can start. Try not to look at the timer.
Okay.
Yes. Here you go.
Hello.
Hello.
Am I talking to Miss Mona?
Yes,
Hi, my name is Dr. Mahmoud. I'm one of the doctor here in the clinic.
okay.
How I can help
Nice.
you today, Dr. Miss Mona?
Doctor, I have been complaining of this lower limb swelling.
Can you tell me more about that?
Actually, doctor, I have complaining of this problem since 6 weeks now.
6 weeks. Okay. So you are saying that you have swelling in your limb, leg, in both
Yes,
leg, in both leg,
yes, yes, doctor, in both legs.
and is this swelling in all over your leg or in below your knee?
I feel it is on your until knee.
Under knee. Okay. And have you noticed that this swelling? Have you noticed any redness of the skin with the swelling?
No, doctor.
Any other swelling in other part on your body?
Sometimes, doctor, as a morning, I feel buffness around my eye, but I don't know if it's related or not.
Okay. Okay. I'm sorry about that, but I will ask you some question and then I will examine you, and I will address all your concern, and hopefully we'll get the bottom of this. Is that okay with you?
Okay, doctor.
Okay. So first, I just want to ask you some few questions, yes or no, if you don't mind.
Yes, doctor.
Okay, so you told me you have this swelling. Have you noticed any fever in the last 6 months, 6 weeks that since started this swelling?
No, doctor.
Any history of flu symptoms?
No.
Any rash in your body or skin changes?
I have no rash, doctor, but when I exposed to sun, I feel my face usually turn to be flushed and red exposure to sun.
Okay. So, and you notice is this rash in your face, it's all over your face or in specific part?
It is only in my cheek, doctor.
Okay. And have you noticed that this rash is itchy?
No, doctor.
No. Okay. And also, have you noticed any change in your weight recently?
No.
No. Okay. So, and have you noticed any joint pain in any part on your body?
Actually, doctor, I have been suffering from joint pain since many years.
Hmm?
But I take painkillers and I can't tolerate it. But I didn't seek any medical advice for that.
I'm really sorry about that. It feels that you have tough time with this pain, but you have this joint pain, which is all the time, or it's coming and going.
Coming and going, doctor.
And this joint pain is associated with swelling of the joint.
Yes, sometimes.
Okay, and you are taking only paracetamol for it. Is that right?
And I take paracetamol. Sometimes I take ibuprofen.
And it's helped.
It helped me mefenamic acid. Also, I can use it. Yes, it little help, and I can't tolerate.
Okay. So that and do you have any medical condition?
No, doctor.
Have you
Other than
taken?
that,
Yes.
I didn't diagnose with any medical condition.
Are you taking any medication for any reason?
Apart from this painkiller, I didn't take any medication.
And do you have any shortness of breath?
No, doctor, I didn't notice that.
No. Any heart racing?
No, doctor, I didn't notice that.
Any headache?
No.
Okay. Any dryness or gritty sensation in your eyes?
No,
No. Okay. Any lumps or bumps on your body?
no.
And can I ask you some question regarding your lifestyle? Do you smoke?
Yes, doctor. I smoke.
How many cigarettes per day?
About 7 to 10 cigarettes per day for the last 7 years.
Okay, but you know, I know that you know that smoking is affecting the health. So we have here the smoking cessation clinics that can help you by give you some medication to decrease your craving. So I can help you with that and book for you an appointment with the smoking cessation clinic if you are happy with that.
Yeah, doctor, thank you. I will think about it.
Okay, and what about alcohol? Do you drink alcohol?
No,
Okay. So and do you have any abdominal pain? Any pain in your tummy? Sorry.
no,
Have you noticed any change in your bowels?
no.
Any change in your water work?
Yes, doctor. I noticed it has become frothy.
Okay. So you notice that. Okay. So and how is this condition affecting your life?
Actually, I'm very worried about my leg swelling, this doctor.
Yes. And what do you do for a living?
I'm a housewife.
Okay. I'm sorry about that, but we will help you to get the bottom of this. So and what is your main concern from today consultation?
I wanted to know why this lower leg swelling, doctor. It is
Okay.
increasing by time. I
Okay.
don't know why.
I really appreciate your concern. Would you mind, and I will answer your question after examining you to tell you exactly what we will do further for your leg swelling. Okay.
Okay, doctor.
Okay. So while I examine you, I might ask you some questions, if you don't mind.
Yes, doctor.
Okay.
Doctor.
Okay. So do you have any conditions that run in family, the same as joint pain or swelling?
Yes, doctor. My
Yes.
mom diagnosed as rheumatoid arthritis.
Your mom is having that water set. And regarding the joint swelling, have you noticed that you have any stiffness in joint in the morning?
Yes, I have some stiffness.
And how this stiffness is improving? Or which stay
Spontaneous, improving spontaneously.
with movement or
Yes, with movement.
okay. Okay, so first I would like to examine you. I need to first to check the vitals. Any abnormalities in the vital signs?
No,
Okay.
uh,
And then
normal.
okay, I would like and the pulse is normal.
Yes,
Okay,
all vitamins.
I need to check the hands for any deformity, any joint, palpate the joint for any joint swelling or redness.
There is some tenderness in the joint of the hand.
Tenderness,
Proximal,
proximate
proximal
tenderness.
intercostal joint and the metacarpopharyngeal joint.
Joint, okay. And no deformity in the joint.
No deformity. No
No,
deformity.
no deformity. And there's only tenderness, no swelling, no redness, right?
Tenderness and the small swelling.
No swelling. Okay. And now I would like to check also the joint of the elbow. Any nodules?
No juice.
No nodules. And then I would like to check the eye for any change in the color, for icterus, any change in the color.
No.
Anyness,
There is malarish in the face.
malarish, okay. And I would like to check for any palpable lymph node, cervical or axillary.
Nothing.
Normal. I would like to a quick have a listen to chest for the heart, any murmur, and to the lung.
Normal.
No. Okay, I would like to palpate the abdomen, deep palpation for organomegaly.
No organ.
I need to check the leg for bilateral beating edema and at which level.
positive until below the 18.
below the knee. Okay. Okay. So, Mrs. Mona, after examining you, I think I need to admit you in the hospital, and to do for you further investigation. Because from the history that I taken after my examination, I think that you might have a condition called systemic lupus. Had you heard about this condition before?
No,
Okay,
this
so
is called lymphedema.
no, yes, this condition, let me explain it for you. It's a condition in which the body, the defense mechanism in the body attacks the own cells, and it can affect this rash that you have in the face, and also can affect your kidney. That's why you have this frothy urine and you're swelling in your leg. So I would like to run for you some investigations, including full blood count, renal function. I would like for you to run for you some investigation, and then I will come back to you with the plan for further management. But I would like to admit you now with us. Is that okay with you?
Okay, doctor.
Okay. I finished.
بس لسه كتير
4
قوي.
minutes.
لسه
Yeah, 4 minutes
Okay.
remains.
Because I'm
If you
thinking,
want to take more history, ask more questions, support.
so I just want to ask you if in examination is the GVP is raised? On examinations, the GVP is raised?
no.
Okay. So I think for this station, because I'm not doing real examination, so in the real exam, I will do 5-minute examination. Now I did it, so I think 10 minutes is enough for me. I don't
Okay.
know.
Okay, let's go to the
No.
examiner question.
Yes.
If no more consent, you answer all consents.
Yes. Do you have any concern?
Thank you.
Okay.
Yeah, let's go to the examiner question. You can ask the question.
What's your differential?
So I think this after examining this lady, I think that I believe that she might have a nephrotic syndrome, because she has puffiness in her eyes and bilateral lip swelling and frothy urine. And most probably the cause of nephrotic syndrome is systemic lupus. After she has a malar rash, and also she was having joint pain with joint swelling. So my top differential is systemic lupus, but I need to exclude other connective tissue overlapping with systemic lupus, other conditions that can cause nephrotic syndrome. So it could be connective tissue disease as systemic lupus, Sjogren rheumatoid arthritis, and then it could be also a malignancy, but this is on the bottom of my differential as lymphoma. It could be malignancy. It could lymphoma. It could.
Okay. How do you investigate this patient?
Yes, for this patient, I need to do first of all bedside investigation in the form of urine dip and blood sugar. I would like to proceed to do the routine blood, including full blood count, inflammatory markers, and the renal function, urine creatinine ratio, and albumin. And for this lady also, I would like to do a specific test for the cause of nephrotic autoimmune screen, including ANCA, anti-systemic lupus, anti-double strand antibody. And also I would like to do an ultrasound abdomen. And further, maybe we consider a kidney biopsy. This is investigation.
Okay. If we said this patient is systemic lupus erythematosus, what is the sign of activity?
The sign of activity, I think the CRP, if it's CRP? CRP is indicating infection. No, ESR and anti-double strand DNA. I'm not quite sure.
Yes. What is? Rob, show me.
And
What
complement,
is? Yes.
complement level. The complement
Yes.
low.
Yes. What is?
So anti-double strand, I'm not quite sure of the ESR and C3, C4.
Yes.
This is what I know.
Okay. How you treat this patient?
I think for this patient, the first treatment for the nephrotic syndrome, systemic, we need to treat the cause, which is the systemic lupus, by immunosuppressive treatment, and we will immunosuppressive treatment, and also we need to check the blood pressure and kidney function, and we can give ACE inhibitor, cyclophosphamide.
In this case, how can be the kidneys affected?
I think it will be nephrotic syndrome. The most common type, it could be diffuse mesengiocapillary. Not quite.
لا قلنا اللوبس نيفرايتس.
Yes.
ايه الستيج بتاعت اللوبس نيفرايتس؟ الكلاسز بتاعتها.
Lupus. It could be. There are five stages. It could be focal segmental, and it could be membranoproliferative, diffuse proliferative, mesengiocapillary. This is the one that I remember from systemic lupus. It could be rapidly progressive glomerulonephritis, membranous glomerulonephritis, diffuse proliferative, and focal segmental.
اوكي دكتورة جزاكم الله خير. انت ما شاء الله عملتي امتحانك كويس بس في شوية حاجات بسيطة.
أنا جالي mental block أصلا.
ماشي ما هي غلسة شوية ماشي. احنا بس بنعمل حالة عشان نذاكرها مع بعض، يعني أكتر من إن احنا نمتحن بعض.
Yes.
والله في الامتحان ربنا يسهلها ونفتكر، بس احنا بنعمل حالة عشان نذاكرها مع بعض، عشان
Yes, but
نفتكرها مع بعض.
try. Thank you, Dr. Sharma. Please try to make it in
Okay.
English. Yes, please.
Okay. In the history, دكتورة سارة, you miss the female history. And
female.
it was very crucial because she has miscarriage 3 times.
Yes.
And she is systemic lupus with antiphospholipid syndrome.
I wrote it in the note, but I forgot to ask it. Yes, abortion. It's important.
We have to study it with her.
Okay.
Also in the history you miss rheumatological panel. When I find one, I should ask about the other skin stiffness, skin stiffness. Also you didn't ask about Raynaud's syndrome, exposure, hand pain during exposure of cold or change in the color.
Yes, you are right.
We can remember it together. So 1 minute.
Shayma, your sound is not clear.
1 minute. I said 1 minute.
Okay.
1 minute. I will just try to find something. When we find one as any joint pain, we should ask about 17 questions, which is any skin rash on sun exposure now or in the past, any shiny skin, any tight skin, any change in the color of your finger on exposure to cold, any difficulty of swallowing, any difficulty of combing hair or combing up stair, any shortness of breath, any cough, any chest pain, any change in bowel habit, any change in water work, any dryness of your eye. This question is very important to know if it is only systemic lupus or Mixed connective
Overlap.
tissue.
Yes.
Any mouse source, any private area source, any history of miscarriage, any history of blood clots, any falling of hair, any dryness of your mouth. What about your mood? Because SLE, there is SLE psychosis. Okay, this is 20 questions. We should ask all of them when we find one.
Okay.
Okay. After that, we talk about a sign of activity. C-reactive protein should be normal.
Yes, even present.
Yes. Investigation for activity, ESR, anti-double-stranded DNA, as you said, and complement level, decreased complement level, as you said. The last one, which you forgot, pancytopenia. Okay. Pancytopenia. When I want to investigate this patient, I will do basic investigation. CBC is the most important thing. In CBC, we will show lymphopenia and leukopenia. Also, we will show thrombocytopenia, and we will see also hemolytic anemia. Okay. Autoimmune profile, special ANA and anti-double-stranded DNA and anti-Smith antibody. This is the most specific. Anti-double-stranded and anti-Smith. We will also do direct Combs test. Okay. Kidney biopsy in this stage because patient come with nephrotic syndrome, and the main reason is the lower limb swelling. So I should do renal biopsy. If I suspect antiphospholipid syndrome, I should do lupus anticoagulant, anticardiolipin, anti-beta 2 glycoprotein 1. Okay. When I treat this patient, I will treat non-pharmacological and pharmacological. Non-pharmacological educate the patient, counseling, psychological and social support, and avoid the sun and give sunblock. Advise with sunblock. Pharmacological treatment, I will give steroid, acute stage and maintenance. Acute stage only steroid plus immunosuppressive as cyclosporin. And if no response, I will give biological treatment. Okay. Maintenance, I will give her non-steroidal anti-inflammatory, hydroxychloroquine, immunosuppression, or biological. So I have 4 options for maintenance. Non-steroidal anti-inflammatory with plus or minus hydroxychloroquine, plus or minus immunosuppressive drugs, plus or minus biological treatment. Okay?
Okay.
I think this question is very important. Lupus nephritis and stages of lupus nephritis. There are 6 classes. There are 6 plus 5. 6. Class 1, normal. Patient will be no treatment. Class 2, mesenteroproliferative. No treatment also.
يلا على سريرك. خلاص بقى على سريرك.
Only observation. Class 3, focal proliferative. And class 4, diffuse proliferative. Focal proliferative and diffuse proliferative. And this the most dangerous classes, class 4 and class 3 and class 4. So I will treat it by intravenous steroid and cyclophosphamide. Both of them, same treatment. Intravenous steroid and cyclophosphamide.
And mycophenolate mofetil also, responsive to mycophenolate mofetil. 3 and 4.
Okay. Class 5, membranous. This is membranous, and this is will respond to cyclosporin. Class 6, glomerulosclerosis, and this is need renal replacement therapy. Okay. If we give the cyclophosphamide, the side effect of cyclophosphamide hemorrhagic cystitis. So we need to give the patient intravenous hydration, good hydration, and mesna, drug called mesna. To be finish all systemic lupus erythematosus, I will give an idea about a small comment on drug-induced lupus. Drug-induced lupus, I have many drugs hydralazine, phenytoin, isoniazide, procainamide, quinidine, chloropromazine, minocycline, and anti-tumor necrosis factor. All this can induce drug-induced lupus. The specific thing for drug-induced lupus, anti-histone antibody.
Oh, yes.
No CNS or renal,
Renal.
only skin and lung. Only skin and lung affection. Okay. The treatment of this drug-induced lupus is double offending indication, non-steroidal anti-inflammatory, low-dose steroid, hydroxychloroquine. That's all. That's it. Thank you.
شكرا.
Yeah, thank you, Dr. Shema. Well done, Dr. Sarah. I want to give you advice, general advice. Whenever you have time, lack it, means there is something
Wrong.
wrong and remains. So
Yeah.
you have to complete the history. As you said, as Dr. Shema said, there is female history missed, plus the association. Be sure systemic lupus erythematosus, if came to you in the exam, it will not be systemic lupus erythematosus alone. You should screen for association. As Dr. Shema said,
Yes.
you have to screen for the mixed connective tissue disease association from Raynaud's, systemic sclerosis, Sjogren. You ask for Sjogren. This is a good thing. Antiphospholipid is very important. Rheumatoid. And the last is systemic lupus, which is our case here. I try to minimize the talk to go for the next scenario. But once you have SLE or rheumatoid or whatever, any disease from these, you have to search for others, either by the target question, like you have any change of the color of the finger or not. You have tightness of the skin for systemic sclerosis, difficulty of swallowing, systemic sclerosis, dryness of the eye, rather than going system review. If you finish all target question for differential, you can go to the system review remains system like kidney. But of course, you will have to ask about the kidney in all this disease. The rash, as you said, and you did in the history and the examination, it's very characteristic for SLE. So don't miss, especially 35 years childbearing period. Whenever you have this case in the exam, put a circle about female history.
Yes, yes.
As we said yesterday, any vision problem, you have put a circle for driving.
Right.
And here also you can ask about driving. Sometimes we have some association of vision affection through either Zika syndrome as rheumatoid or as scleritis with rheumatoid or Sjogren dryness. You have to ask specifically about driving. So this is about the history. The examination, you will do also examination for the whole disease, Raynaud, scleroducty, for systemic sclerosis, tightness of the skin, the joint, the correction of the deformity. But I guess here it's Jacob arthralgia, not rheumatoid. And when you ask about the stiffness, you have to specify for how long you have the stiffness. More than 1 hour, it will be characteristic for rheumatoid. If less, you'll be having other seropositive arthritis. Okay?
Okay.
For the investigation, yes, you can
She
ask
asked me
for
a question about what is the differential of nephrotic syndrome.
Yes, so yes, nephrotic, starting by lupus nephritis, and in this case, you can put the membranous or idiopathic, I mean, or drug-induced. This for the case. And we will ask Dr. Shena to give us the differential, but this is my differential. So lupus nephritis, membranous or idiopathic nephrotic syndrome, and the last is drug-induced glomerulonephritis. I will add also comment about the buffness of the eye. You should ask when you have swelling of the leg, you have to ask about the buffness of the eye, even in the examination. The heart failure signs. All this, you will do it as an examination. Investigation, you have to say the antibodies by complete name, not anti-nuclear antibody. You have to say like that. Anti-double strain and anti-Smith as anti-Ro, anti-La, all antibodies you have to do. Once you have one of the autoimmune, disease, you have to screen for others. They are coming together. They are never coming alone.
Okay.
Sometimes you can find, even the disease is not manifested, you can find some other association with the lab, I mean investigation-wise. Okay. For the management, as Dr. Shaima said, if the patient came in acute attack or acute presentation, you have to do ABCD approach. Patient might come as renal failure and with pulmonary edema. You have to admit the patient. You think about ABCD, then maybe dialysis, diuretics, according to the stage. Don't miss the renal biopsy in such case. It's very important for staging. And based on this, you will give the management according to the stage you have. Okay. This is in general as advice. Please try to be as much organized in this disease. Yesterday we did the MIN. It came as acromegaly, but never acromegaly will be acromegaly alone. You have to screen for the association, which is MIN1, or if you have MIN2, whatever. So always in the exam, they are not bringing something alone. And if it come alone, you have to screen for the association to show the examiner you are thinking wide. You are not thinking about disease only. You are thinking about association, complication, and so on. Okay?
في
Thank you.
نقطة
So
عايزة أعلق عليها معلش.
yes,
هو
yes, sure.
احنا يعني we usually if there is any rash, mild rash, this is systemic lupus.
Yes.
If there is no
Until
rash,
proof otherwise, yes.
if there is
If
no
no
rash,
rash,
but there is joint pain and there is history of miscarriage. This was my case in the exam, and I lost. There is no rash, no sun exposure, no sun exposure.
yes,
And the concern of the patient, am I rheumatoid arthritis as my mother, and the stiffness 1 hour.
yes.
يعني
So
no
yeah,
rash.
sometimes
I
maybe
said
the patient
this
is
is rheumatoid arthritis actually. But when I study the systemic lupus, one is the mother rash, one criteria, and it may be not found. There is
yes,
another criteria. You should to have 4 from all the criteria. And the criteria
yes,
there is joint pain. There is joint pain tick number 2 or 3, and the ASR is elevated. If elevated, there is 1. You can fulfill the diagnosis without mild rash. And actually, the stiffness for rheumatoid arthritis more than 2 hours, not 1 hour.
what
I
I
read it
remember, yeah,
in notes in recently. Rheumatoid arthritis more than 2 hours or 2 hours. But
anyway, you will not
arthritis,
find, yeah, you will not
hmm?
find stiffness more than 1 hour in other disease. Even 2 hours, yeah, 2 hours more than 1 hour. Anyway, we'll not argue about the duration, but stiffness for a long time, and it will take time until it will be resolved. Okay,
Okay.
regarding the rash, Dr. Shaima, the point here, maybe the patient is not exposed to the sun. Maybe she's at home, so it's
No, Dr. Hom, زي يعني
they brought
intend
it
to.
like this.
Oh,
Yes,
yes.
to
Yes.
make to make you confused.
I would ask it about the rash now on the bus. I didn't ask this
Yes,
question
yes.
at this time.
This
Now on
this
the
is
bus, I
exactly.
asked about any rash, skin rash on sun exposure. No. Any skin rash? No. Okay. And also, but there is something. If there is a patient who has lymphopenia, in the scenario they wrote lymphopenia. This is one of the criteria. Lymphopenia or leukopenia. This is one of the criteria. And also, patient has antiphospholipid syndrome. Antiphospholipid syndrome mostly with systemic lupus, not with rheumatoid.
Yes,
So
yes, but
I
you
confused at this time. I confused, but yani I said not only the rash, not only the rash.
yes,
Okay.
yes, we are learning, yes, but you will have other criteria. As you said, it's not
Yes.
rash,
Yes.
but you will have antiphospholipid, you have stiffness, you have
And
arthralgia.
every information in the scenario should be
Yes,
very crucial, very crucial.
Yes.
You will not
Yes.
find it again, and it is very important. Lymphopenia in long clinical consultation, I didn't concentrate at this time, but it was one of the criteria. It is a clue with this pain, with this antiphospholipid syndrome. Okay.
Yes.
I want to I ask you, Dr. Sarah, about how the kidneys can be affected in this patient. And then we explain the lupus, systemic lupus nephritis, but also this patient always on in painkiller, and the painkiller can cause interstitial
Yes.
nephritis, can cause papillary necrosis, can cause also papillary necrosis, interstitial nephritis.
Membranous glomerulitis, drug induced.
No. I will. It's 1 minute. Just let me open my note.
But the painkiller causes an
Acute tumoral necrosis,
but not
interstitial nephritis, analgesic nephritis.
but not nephrotic syndrome. The patient presented with nephrotic syndrome.
There
Yes,
is some
I
disease
ask you how is the kidney in this patient can be affected.
Yes.
Okay.
Could be from the disease itself, or could be from the drug
Yes,
or the disease.
some of the drugs, the medication
exactly.
change.
Yes.
Okay. What is the differential diagnosis of the lower limb swelling? We all know renal failure, liver failure, heart failure, hypothyroidism. This is the main causes of lower limb swelling. Okay.
Okay. So is the case in your exam was rheumatoid arthritis, not systemic lupus?
I said that, yes. Rheumatoid arthritis, not systemic lupus.
Okay.
Because I was confused. This is my
Maybe overlap.
That's why. That's
can
why if you put overlap, it could be accepted. If you said mixed connective tissue, it will be accepted. Don't narrow your diagnosis as long as you have multi-system affection. Anyway, we are learning from the mistakes, and the mistakes teach us more than the correct things. We have to learn from the practice and from the mistakes we are doing in the practice. For you, Dr. Sarah, the SLE now, you will never forget it, but please read it. Read
Yes.
the staging. They will ask you about the staging. Dr. Shayma already mentioned.
Yes,
And the medication and the association. Antibodies, as you said, CRP will be negative unless there is infection. The activity by its complement 3 and 4, the antibodies titr, and the SR as well, it will be affected. Very common topic, and I don't want to waste more time in this scenario. Let's go to the next scenario. Dr. Sarah, please write the scenario for Dr. Shayma.
I wrote it in the
Yeah, okay. 60 years old female, Jonah Smith, complains of persistent cough, weight loss. By the way, there is question, Dr. Sarah, for the anemia. What the possible cause of anemia in SLE? And you have to know what are the causes of anemia in SLE.
anemia of chronic illness.
Excellent. Then,
And I don't know, autoimmune, it could be autoimmune.
yes, autoimmune, yes.
Okay.
Autoimmune hemolytic anemia, anemia of chronic illness, drug induced or bone marrow suppression. Okay. Dr. Shayla, then you start. I will read the other comment. Pancytopenia is a sign of activity. It is part of criteria, but acetyl activity. This is my first time to hear about this. Source of information, please. Yeah, Dr. Shayla will share us in the WhatsApp group. For me also, pancytopenia.
Really, the
Okay, but
lymphopenia just
yeah.
indicates this is affection of the kidney. It will let you investigate more for the kidney. If you have systemic lupus, when on follow up with lymphopenia, you should screen for kidney disease
Okay.
because it means like consumption. You consume this like the complement, so you are in
Yeah.
active inflammation. You are in big problem, so you will investigate more. It is not the usual. Usually, it is lymphopenia with systemic, but not too much, not concerning. Because you
Yes.
will consume these lymphocytes in the autoimmune. This is the same in Crohn's, same in inflammatory condition you will find the lymphopenia with.
Okay. Also Cushing, I guess. Lymphopenia and Cushing with
Cushing, I
eosinophilia
think, because there is reduced
activity of leukocyte
yes,
count.
not
Yes,
for
yes.
consumption. Yes.
Consumption, yes. Okay.
Mm.
Dr. Hadil wrote here differential membranous nephropathy, renal amyloidosis, non-steroidal inflammatory induced nephropathy. Agree?
But we should know the stages of affection of nephritis by name.
Yes, I wrote it in the group. I made it in.
It's very difficult for me.
No. Listen, Dr. Aisha. 1 and 2 similar. 3 and 4 similar. 5 and 6 similar. I will tell you now. First and 4 normal and mesangial-proliferative or mesangial-capillary. 1 and 2 normal and mesangial-capillaries. 3 and 4 both of them proliferative. 3 is focal proliferative. 4 is diffuse proliferative. Okay.
Okay.
Fifth,
لحد
you will
دلوقتي
take
حلو.
yes, you will take fifth from 4. From 4 you will take diffuse and you put it diffuse membranous in fifth. We reach to 4, which is diffuse proliferative, right? You will remove proliferative and you will take diffuse and you put it diffuse membranous glomerulonephritis. The 6th, advanced one and different name, separate name, focal segmental sclerosis. Sclerosis is like fibrosis, so the kidney become damaged, fibrotic, sclerosed.
So it's stage 4 and 5. This is the dangerous stage?
No, yeah, the most common is 4.
No, 3 and 4.
3 and 4.
3 and 4. 3 and 4 is the most dangerous. There is proliferative, diffuse proliferative, and focal proliferative and diffuse proliferative.
Yes.
Both
And
need to
one is more diffuse, more affected. Okay.
Yeah, and the 4th is the commonest ever in the river.
And it is reversible. In which stage it's reversible? 4? Till 4?
Reversible, I guess. Still, when you are in 3, it's reversible. I guess 4, going more to the advanced stage. I'm not sure also, but what I know, the 4th is the most dangerous and the most common.
Okay.
Yes.
So 1, 2 mesangial, 3, 4.
1 normal, 2 mesangial. 3 and 4 both are proliferative. 3 focal and 4th is diffuse, but both are proliferative.
Lymphoproliferative.
No, proliferative, diffuse and focal.
Proliferative only? Okay.
Diffuse and focal. 3 for focal, 4th is diffuse. 5th, you will take diffuse from the 4th, diffuse membranous. It will be 5th.
So what is focal and diffuse?
3 and 4. Yes, proliferative. You will take diffuse from 4th, you will put it in the 5th, diffuse membranous. Okay, no proliferative more.
Okay.
And the last, focal segmental sclerosis. Yeah.
Sclerosis. Okay.
And the
Yes,
is mesangial-proliferative or mesangial-capillary?
Mesangial-capillary, because if proliferative, I will put it with 3 and 4.
Mesangial-capillary, okay.
Yes, and they are normal in ultrasound, by the way. Both 1 and 2 normal in ultrasound. I will share it again. I shared it before. And as I said, 3 and 4 are responsive to steroid, as Dr. Shaima said also, steroid responsive and cyclophosphamide and MMF, mycophenolate mofetil. And in real cases, in my patient ICU, 3 and 4 and systemic lupus patient, they are on MMF. A lot of patients on MMF, mycophenolate mofetil, and they are responding to. So you have to mention this drug through 3 and 4. Okay.
Okay.
I will share it.
Helpful, really, Dr. Best. Thank you.
Yes, mesangial only, no proliferative. Yes, it's not mesangial capillary, mesangial glomerulonephritis. Nothing added. I will share it again to the group. It's start message for me here. Focal, diffuse, then diffuse membranous, then sclerosing nephritis. You can see it now, Dr. Aisha, also to be more memorized. Let's go to the next scenario. You ready, Dr. Shaima?
Okay, Doctor.
Yes. Here you go.
Okay.
Good morning.
Good morning.
I am Dr. Zabel, the doctor in the medical OPD today. Are you Mrs. Joanna?
Yes,
Miss 6 years old?
yes,
Okay, Mrs. Joanna, today we are here to discuss issue related to your health and I will examine you. Is it okay with you?
yes, please, doctor.
Miss Joanna, it came to my knowledge that you are complaining of cough and weight loss. Can you please tell me more about that?
Yes, doctor, I have this cough for a long period of time, and it's become more in the last months. The GP told me that I'm having asthma, and I'm taking my inhaler, but the inhaler is not helping me with this cough.
Okay, Mrs. Joanna. What about the weight loss? How
Yes,
many kilo or how long?
I think I lost about 2 kilo in the last 3 months. I become more weak.
2 kilo about in the last 3 months?
Yes.
Is it intentional?
Yes, it's not. I'm not having appetite.
Appetite, loss of appetite?
Yes, I'm not eating well because of this cough, and I'm feeling myself weak, so I don't have appetite.
I'm sorry for that. Mrs. Joanna, this is cough present for how long, Beck?
So I have this cough for about maybe 7 months, but it became more persistent in the last months.
7 months. Before this 7 months, there is no cough.
Yes.
Okay, this is the first time to have this cough, this 7 months.
Yes, but I was having asthma also before, and at the beginning it was controlled with the inhaler, but now it's not controlled with the inhaler.
Before 7 months, you have asthma?
Yes, I was diagnosed with asthma for 2 years, and
3 years.
yes, for 2 years, and the GP gave me an inhaler. At the beginning, the inhaler was controlling my asthma, and then now I'm feeling that, and also I wasn't having cough, but now when I'm taking even the inhaler, I'm still having this cough.
Okay, I'm sorry for that. Can you please tell me how did you diagnosed as asthma? By blowing test or nothing?
I think when I went to the GP, I told him that I'm having wheezy chest, and I have my father was having asthma, and also it was with cold, so he gave me the inhaler.
Okay, but there is no blood. Okay. Mrs. Joanna, can you please tell me about this cough? Is this cough have dry or have phlegm?
No, it has a phlegm.
Phlegm.
Yes.
Can you please tell me about this phlegm?
It's a thick phlegm, and it's I think sometimes it's yellow greenish, sometimes it is rusty in color,
Rust-
but not blood,
Rusty.
but no blood. Yes.
No blood.
No.
Okay. Can you please tell me about the amount of this amount of this phlegm?
Yes, sometimes I'm having too much phlegm. It's
Too much phlegm.
half a cup.
Have a cup.
Yes.
Okay, I'm sorry for that. Mrs. Joanna, did you notice that the drainage of this phlegm affected by the posture of your side? You can move from side to side to increase the phlegm to drainage it.
Maybe doctor. Yes, when I'm sitting, I'm able to have to have this phlegm out.
Okay, Mrs. Joanna. Miss Joanna, can you please tell me if there is any high body temperature,
No, I don't have temperature.
any lumps or bumps in your body,
No, I didn't notice that.
any contact with ill patient?
No.
Any contact with patient diagnosed with by tuberculosis?
No, I'm here living in UK. I didn't travel for 2 years.
You didn't travel?
Yes.
Okay. Mrs. Joanna, can you please tell me, do you have any past medical illness or surgical operation should be aware of?
No.
No? No hypertension, no high blood pressure, no high blood sugar?
No, I don't have any medical condition.
Do you have any surgical operation before?
No.
During your childhood, do you have any repeated infection?
No, I was having the normal flu. Sometimes I'm having some flu. I got COVID twice. So this is the thing, but not these two
Okay, Mrs. Joanna.
any flu symptoms in the last 2 months.
Okay, Miss Joanna. Do you have any medicine?
What?
Medicine? Any medicine?
No, I'm not taking any medicine.
Do you have, what's your job, Mrs. Joanna?
I'm working as a secretary in the company.
Secretary in the company?
Yes.
Do you have any contact with any pets?
Pets?
Yes.
Yes, I have a dog, but I have my dog is with me for 8 years now.
8 years now. You
Yes.
have your dog. Any
Yeah.
other pets?
No,
Any other contact with any other animal?
no. But sometimes
Okay.
I'm going to see my sister, and she has a cat. She bought a cat maybe 4 months ago, and I was seeing her on irregular basis. So I'm not quite sure if this could be related or not.
Cat. Okay. Okay, Mrs. Joanna. Okay. Okay, Mrs. Joanna. Mrs. Joanna, are you married?
Yes, I'm married.
Are you sexually active?
Yes, but I'm 60 years old now, so I'm not sexually active frequently.
Okay, Mrs. Joanna. Do you have any history of unprotected sex or casual relationship?
No. I have a regular partner.
Okay. Miss Joanna, you have a period stop, yes? Since how long?
It stopped when I was 58 years.
Okay. Okay, Mrs. Joanna. Mrs. Joanna, do you have any joint pain, any skin rash,
No,
any change in water work?
no.
Okay. Mrs. Joanna, I will ask you some questions. It may be a bit irrelevant, but it will give me an idea, okay?
Okay.
Mrs. Joanna, do you have any headache,
No,
any loss of sensation,
no,
any abnormal gait, any abnormal movement,
no.
any okay. Do you have any shortness of breath?
No, sometimes I feel my breath high, and sometimes my chest is busy. It's become noisy. It could be related to the asthma. I'm not quite sure.
Okay. Do you smoke, Mrs. Joanna?
Yes, I'm smoking.
How many cigarettes per day?
10 cigarettes per day
For how long?
for the last 20 years.
20 years.
Yes.
Okay. I strongly advise you to stop smoking, Mrs. Joanna. It has a bad effect on your life, on your health. I can help you by referring you to smoking cessation clinic if you don't mind.
Okay, I don't have problem with that.
You drink alcohol?
Socially.
Okay. Mrs. Joanna, Miss Joanna, is this complaint affect your life and daily activity?
Yes, it started to affect me at work by this cough. I'm feeling embarrassed in front of my colleague, and sometimes I have this cough that it prevents me from even talking.
I am sorry for that, Mrs. Joanna. I will try to help you as much as we can, and I can refer you to a occupational health doctor, and I can write a letter to him to give you sick leave or to give you a day off
Okay.
until control your condition. Okay.
Okay.
Okay, Mrs. Joanna. Mrs. Joanna, do you have any tummy pain?
No.
Any tummy distension?
No.
Okay. Any hard motion or loose motion?
No.
Okay. Do you have any a change in the water work? You said no.
No.
Any frost urine? Any frost urine?
No.
Okay. You said you didn't have any joint pain, yes?
No, I don't have any joint pain.
Okay. Or any skin rash?
No.
Okay. Do you have any weather preference?
No.
Okay. You didn't take any medication except this is the inhaler for asthma, yes?
Yes. And I'm not taking it now. It's not helping me with the cough.
Okay. Any family history if not?
No. I think my father was a smoker and he died from cancer. So this is my main concern about these coughs that I'm having. Could I have cancer?
Okay, let me examine you first, and I will answer this concern. Okay.
Okay.
Any other family history?
No.
Okay. Your concern is that you have cancer or no? Yes?
Yes.
Okay, I will examine you. Can I examine you, please?
Yes, please.
What about your hand? If there is any clubbing?
Yes, there is clubbing.
Okay. Is there is any flapping, if any palmar erythema, any
No.
palmar erythema, any
Only clubbing.
any sweating?
No.
Only clubbing. Only
Yes.
clubbing. Okay. I need to check the blood pressure and the blood sugar sitting you standing. Blood pressure sitting you standing.
No.
There is any proximal myopathy?
No.
Okay, I will see the eye if there is any pallor or jaundice.
No.
Okay, I will see the mouth if there is any ulcer or
No.
any cyanosis.
Nothing.
Okay, I will start to examine the chest by auscultation.
Yes.
I will auscultate the chest. There is any crepitation?
Yes, there is crepitation.
In which spot?
There is crepitation in the lower zone. A change with coughing, and some occasional wheeze.
Some occasional wheeze.
Yes.
Okay. If I ask you coughing, it will change?
Yes, changing with coughing.
Partially change it or change it completely?
No, partially changed.
Partially changed. Okay. Heart, is there is any problem in your heart?
No.
Okay. Is there is any organomegaly?
No organomegaly.
Okay. The woman كشكتك any
She look
كشكتك
كشكتك.
looks كشكتك?
Yes.
Okay. Okay. Any container contains sputum beside her?
She's coming in the clinic, so she does.
Okay. I'm sorry. Okay. Mrs. Joanna, can I ask you some question, please?
Yes.
Is there is any history of repeated infection of a history of repeated infection?
I don't know. I have infection as normal people. I'm not quite sure which infection you are asking me about.
Chest infection. I asked you about chest infection.
I was having flu symptoms before, and maybe
frequent attacks.
Any what?
Frequent attacks.
No frequent attacks. It's no as normal people.
2 minutes left.
Okay. Okay, Mrs. Joanne. What's your concern?
I told you my concern, doctor. Would these symptoms suggest that I'm having cancer?
Actually, from you said to me and after examining you, cancer is a possibility, but it is not the first possibility. As you are a heavy smoker since 10 years now, so cancer is a possibility. But the main concern is a condition called bronchiectasis.
So what?
Don't bother yourself by the name. This is a medical term for medical condition in which there is obstruction of the wind the airway pipe closed by secretions and something like that. What we need to do now is to do some blood investigation and the imaging in your chest to confirm the diagnosis and rule out cancer. Okay, Mrs. Joanne.
Okay. So I will be admitted, or I can go home after doing this test?
I will admit you until further assessment.
Okay.
I have a further assessment, and I will sit with you again to tell you about the result, and you will be managed under the doctor of chest doctor.
Okay.
Okay. Okay. Thank you. You have any other concern, Mrs. Joanne?
No, thank you, doctor. Thank you.
Okay.
Okay. Any further advice from you?
For the time being, I want from you to stop smoking, Mrs. Joanne.
Okay. I will
Okay.
Yes, okay, time is up. Let's move to the examiner question. Start, Dr. Sarah.
tell me what is your diagnosis and what is your differential?
This is Mrs. Joanna, 60 years old, come with cough and weight loss. This is my first differential, as she has this cough and the course crepitation and the course crepitation, and it partially changed with cough. My first differential is bronchiectasis.
Yes. And
Other differential, it may be cancer.
Hmm.
It may be COPD. Maybe emphysema, but there is no high blood pressure, high body temperature. It may be also fibrosis, pulmonary fibrosis, but the cough is productive cough, not dry.
Okay. So, and what is the respiratory causes of clubbing?
Respiratory cause of clubbing, it may be suppurative lung disease,
Hmm.
like bronchiectasis, and like emphysema, or squamous cell carcinoma, or fibrosis, pulmonary fibrosis, can cause clubbing.
Okay, and what investigation you will do for this patient?
First of all, I will do basic investigation in the form of complete blood count, liver function test, and renal function test, erythrocytes, limitation rate, and C-active protein and electrolyte. I will do chest X-ray. I will do sputum culture and sensitivity. I will searching about the cause of bronchiectasis. If this is bronchiectasis, I will do also high resolution CT. High resolution CT, I will see in it singlet ring appearance. And the X-ray, I will see in it the tram line. And I will do anything. I will do high resolution CT, and I will do investigations for complication, which may be respiratory failure. I will do ABG, and I will do also ECG and echo, and I will do also if I suspect pulmonary hypertension, I will do echo catheterization, and I will search about the cause, maybe post-infection, mainly or post-TB. It may be due to autoimmune hypoactivity, hypogammaglobulinemia, or common variable immunodeficiency. It may be due to association with inflammatory bowel disease, but there is no loose motion and there is no symptoms. I will do also. It may be aspergillosis, but allergic bronchopulmonary aspergillosis, but there is no direct contact with dog recently, with animals, birds recently.
Okay. So you told me the complication of bronchiectasis. You said about the sinus ring sign. What
Yes.
is why we can see the sinus ring sign on the CT scan? What is
as the bronchi will be dilated in corresponding with the blood vessel. So the blood vessel will appear as a singlet ring. I will draw it for you. This is a bronchi which is dilated, and this is a blood vessel small.
Okay.
So it will be appear as a singlet ring appearance.
Blood vessels. Okay, good. Okay. So I'm done with the question. Okay. Good. But for this patient, what do you think the cause of bronchiectasis? She told you that for the allergic bronchopulmonary aspergillosis, you are confused about two things: the allergic bronchopulmonary aspergillosis, and the other one is the eosinophilic alveolitis. The allergic bronchopulmonary aspergillosis, the patient will have a history of asthma that not responding to the bronchodilator. So it might be this patient. She might have bronchiectasis due to allergic bronchopulmonary aspergillosis, and she might have this bronchiectasis due to attraction of a tumor. She has a tumor because she's smoking and has a family history of cancer, and this tumor doing traction and cause this bronchiectasis. Okay, This is, I think,
يعني
two.
this is caused by tumor. This patient has tumor, cancer يعني.
No, but this is the differential. But this patient, she has the cause of bronchitis is allergic
Dr. Sarah, you are commenting now, or
yes, now I'm start to comment.
yeah, but it's supposed 5 minutes to be for a question, okay? But anyway, if you finish question, examination, investigation, management, everything done?
Yes, I didn't ask about the treatment. What's the treatment for this patient?
Yes.
Yes, this treatment of this patient will be non-pharmacological and pharmacological. Non-pharmacological is a form of patient education, counseling, and patient education, counseling, and pulmonary rehabilitation program.
Yes.
Okay,
Mm.
and the pharmacological in the form of posture drainage, physiotherapy, and posture drainage, and antibiotic, a treatment of the acute attack by bronchodilators and inhalers, and it may be need antibiotic according to culture and sensitivity.
Okay.
And I may need lifelong antibiotic azithromycin 3 times per week. And if this patient has 2 attacks of Pseudomonas, can give her also lifelong anti-Pseudomonas اللي هو tobramycin inhaler, Clistin inhaler, and azithromycin oral.
Okay. And what is most common if the patient has infection with bronchitis? What is the most common organism?
Haemophilus influenza
Hmm?
and Streptococcus
Hmm?
and Pseudomonas.
Correct. Good. Okay. So I finished my question.
Yeah, one more question. Sorry, Dr. Sarah. What's important in bronchitis patient you have to advise apart from smoking? Dr. Shahar.
Again, doctor, again.
What advice you can give and what other long-term management
The main
for recurrent
concern of the management is posture drainage.
no other than posture drainage and the medication, the antibiotics, something important here
Vaccination.
for yes, the vaccination.
Yes.
Yes, vaccination is important.
Yes.
And yes, I
This
am
is the
done.
non-pharmacological, one of the non-pharmacological vaccination.
It's considered as
education.
pharmacological because and stop smoking is, as you said, is very important. Okay,
Yes.
Dr. Sarah, you can comment now.
Okay, so first you did the station well. You asked well about the patient. But I think when I say that my father was having cancer, you jump to the other question. I know, me too. I'm doing these things. I'm not thinking about address the concern immediately. So you can say, I'm sorry about your father, but we will address your concern. So say this, because when I told you my father has cancer, so you jump to the other question. You did everything in examination well, you took the history well, and you asked about everything from bronchitis, and you got the diagnosis. But I think for the cause of the bronchitis in this patient, she was having allergic bronchopulmonary aspergillosis because she has a history of asthma, which is resistant to bronchodilator. Okay.
But this is not allergic bronchopulmonary aspergillosis. This is extrinsic. You mean extrinsic allergic alveolitis?
No, it's extrinsic allergic alveolitis. There is a history with contact with birds, pets. That's why you are confused between
the product.
This is, I think, this is.
The extrinsic will be with the product, fancier, and the products of
allergic bronchopulmonary aspergillosis.
Yes.
Yes,
will be,
she's right, but it will be brown. This brown expectoration, Dr. Sarah.
I told her rusty. I told in the.
Okay. Yes, but I hear also green. So if green means Pseudomonas, so be more specified. Yes, but rusty or brownish. This will be clue for ABBA or allergic bronchopulmonary aspergillosis. You're right. It will come in based on aspergillosis. Sorry, history of long asthma, yes, uncontrolled.
And resistant to bronchodilators. So the patient asthma resistant to bronchodilator. This is the cause of bronchitis. I think you asked about the vital signs. You forget about
Yeah,
Yes.
yeah.
I don't
She
know.
asked her.
So it will be tachypnea.
Yes,
Okay.
Yeah,
And
she asked.
I
She
think
said
I
any
don't know.
abnormal finding in the vitals. Yes.
okay, maybe. And the other things, so if you have the allergic bronchopulmonary aspergillosis, you should add the investigation, which is the IgE and
Yes, yes. So I asked about it many times, but بصراحة I forgot that it will be in asthmatic or patient.
no, I think the extrinsic allergic alveolitis. This is I remember from the pets or with birds and has a recent contact with that, but I'm not quite sure. The other
Yes, you're right.
yes, the other thing, you didn't say that you will do pulmonary function test, which is important, and the obstructive pattern.
Yes.
Yes, so I think this scenario is a big scenario. So we'll discuss
Yes.
it and we'll see. So this lady presented with persistent cough, copious secretions. She said rusty, but sometimes the patient can say yellow, green. So take the most things that I say rusty, because all the patient can say different color. But rusty, as Dr. Basim said, it's characteristic. She has she's cachectic, and she has weight loss. So most probably this patient will put our top bronchiectasis. So we need to check for the causes. So first you need when you examine, first you need to check for yellow nail and lymphedema to exclude yellow nail syndrome. It could be congenital as CF, cystic fibrosis, and Cartagner. So you will ask.
Clubbing as well.
Yes, and the clubbing, you should ask about some question about cystic fibrosis, a family history, or some in examination the
Yes,
pancreas.
I asked about family history to know if there is anything and any childhood, any repeated infection. This is I was
Yes.
Pancreas,
searching
maybe
for.
I guess also, Dr. Sarah, cystic fibrosis will be presented earlier in younger
young,
age.
yes, it will be in young age. But I'm saying
Yes.
the topic itself.
Yes.
Yes,
Yes, of course she
yes.
should roll it out. Yes. Go
And
ahead.
if it's cystic fibrosis, it will be a young age, and she will having clubbing. You will find a peg feeding. Will have a peg feeding.
Yes.
A cord, you will find it in her chest, and she might have diarrhea or diabetes. So if it's cystic fibrosis in young, yellow nail syndrome, you'll find yellow nail and pleural effusion and some lymphedema. Okay, and then you and it could be due to infection in childhood. You ask about infection. It could be TB, measles, any infection. You ask about it could be to inflammatory bowel disease, and you couldn't find any positive GIT finding. And for this aspergillus, we said that it's asthma resistant to bronchodilator. It could be also the traction by tumor or foreign body. But I think we won't be asking about that. Only with the tumor, you can say it by she might have a history of tumor and cause this, and the tumor compressing and cause the bronchiectasis, and she might have.
How can I ask, Dr. Sarah? How can I ask about tumor? I asked about any surgical operation, any
No.
medical.
Doesn't she might be have a cancer now, and this cancer is compressing, and this cancer
Yes.
and cause traction and cause the bronchiectasis. So she has a cancer but not diagnosed, but now presented with bronchiectasis. Okay, so
Yes.
put it in the differential. You won't ask about this question, but it is one of the cause of bronchiectasis. And also the patient could be chronic alcoholic with aspiration. She has GERD, and that GERD caused for her the bronchiectasis. Okay, so this is the causes of bronchiectasis in general. Okay, you ask about
Yes.
the patient is social drinker, so it's not the cause. So the examiner can ask you the investigation. So you will do the routine, the sputum, the pulmonary function. You'll find obstructive, and some specific investigation for the causes, as we said the causes. And for this case, we'll do the IgE and Aspergillus perspectum. Okay,
Yes, and I'm positive for aspergillus also.
yes. And they can ask you about the respiratory causes of clubbing. You said it. It could be abscess, bronchiectasis, cystic fibrosis, tumor, empyema, and then we can ask you. You said the treatment goods. The important thing in treatment in bronchiectasis and even in interstitial pulmonary fibrosis, the first thing you say, multidisciplinary team and pulmonary rehabilitation. So pulmonary rehabilitation in both conditions is important, especially in interstitial lung fibrosis. This is the main treatment. If you say pulmonary rehabilitation, so this is the treatment for interstitial lung disease. And here also, And you said that you will do posterior drainage, active cycle breathing, smoking, and as Dr. Bassem say, she should have vaccination, all the vaccinations, the flu vaccine, pneumococcal vaccine, all the vaccinations that should be provided for her, the treatment, prophylactic, antibiotic, bronchodilator, mucolytic. And the complication of bronchiectasis, she might have infection, she might have hemoptysis, frank hemoptysis from mycotic aneurysm, I think. And
Invasion, yes.
yes, and she might have symptoms of cor pulmonale. When you examine, that's good that you examine
Yes.
included cor pulmonale by checking the GVP, right ventricular heave, loud P2. So you checked about this. The
But
patient,
it can be localized bronchiectasis in this situation or generalized bronchiectasis.
I think the CT scan will say it's not. We could.
Yes.
We
I
could
think if we hear the chest, it will be like in specific area or generalized
According to Dr. Aisha,
trachees.
accordingly, if diagnosed with cancer, it could be unilateral. But if
No,
no
yes,
cancer,
for I asked about
if ABBA, it will be bilateral.
bilateral.
Yes.
and other complication, it could be also secondary amyloidosis. This is, you said, they can ask you the question, what is the X-ray finding? So you say that tram line and some ring shadow, and what's the CT findings, the sinus ring appearance. You did it well, and you said because that the bronchus is morely dilated to the adjacent blood vessels. That's why it's look like a sinus ring. Sinus ring, it's mean, you know, when you have the ring with the normal ring that has a bulge. So
Yes.
this is
Yes.
bulge, and this is the sinus ring. So this is, they can ask you this question. So I think this is the most question to cover in bronchiectasis in the exam.
And I think the branching in the X-ray for aspergillosis or bronchopulmonary aspergillosis, this will be like branching
I don't know about this one.
fine on the X-ray.
Tram line in the X-ray, tram line. The
Not
same of bronchiectasis.
itself.
Will be consolidation, collapse, maybe.
But I think in the exam we don't have, in the exam we don't have too much time, and also I didn't
Yes.
give something regarding, because it's only 4 minutes. I didn't practice to make, but most of my colleagues saying in the exam, don't say I will do full blood count, say I will do it.
Yeah.
I will do, and then the examiner will ask you what is the finding.
Yes, exactly.
Immune screen,
Yes.
and continue. So he will ask you what especially you will find in that. So we couldn't talk and say all these things because we won't have time, and the examiner has some question need to ask.
Yes, exactly.
So say it. Don't say the pulmonary function. It will be we'll find obstructive. You can say obstructive, but don't say FEV1, FEVC, obstructive pattern. I will do sputum culture. I'll do routine blood, bedside observation. Try to make it quickly, because the examiner will have time to ask you about the questions. But
Yes.
say
I think Ababa more in farmer, yes.
No, the extrinsic, the farm.
Both, but Ababa also in farmer. Yeah, type 1 and type 3 hypersensitivity reaction to Aspergillus fumigatus. I read it from source, yeah. It is mainly in farmer. Type 1 and type 3 hypersensitivity reaction to Aspergillus fumigatus affect mainly asthmatic and cystic fibrosis patients.
Yes.
But it also we should react to this Aspergillus fumigatus, which more in farmers, with farmers.
Yeah.
Okay.
Okay.
The clue here is she is asthmatic and not
Exactly.
recently not respond to the bronchodilator. Yes.
Yes.
Okay. There's something also I forget it in the treatment. We can to finish this. Also, the treatment may be surgical.
Yes.
And surgical lobectomy, pneumonectomy, bronchial artery embolization, and lung transplantation.
Yes.
Thank you for this nice program.
Okay, thank you. I prepared, and then I said if I will say it,
Thank you
Yes,
very
of
much.
course.
There is a question في الأردن بتسأل what is the cause of obstruction in bronchiectasis.
Yes.
It is not due to bronchoconstriction.
Mucus plug.
Yes, it is due to mucus and edema and secretion and granulomatous
Foreign
substance.
body. Even foreign body can lead.
No, this is not the cause of bronchiectasis. No, bronchiectasis. Why there is obstruction in bronchiectasis? Pathology. There is
Okay,
no
yes.
bronchoconstriction. There is secretion, mucus, edema, granulomatous substance. Okay. Thank you, Sarah, Dr. Sarah, for this nice case, wallah. Thank you.
I will send for you on the group table that it says that how to ask about the cause of each of the condition from bronchiectasis, and you will find that the allergic bronchopulmonary aspergillosis, it's written the asthma, it's one of this, so you can have a read about this.
Yes.
Yes, I will share also from past tests compared allergic bronchopulmonary aspergillosis and eosinophilic. I read now it's eosinophilic related to the farmer, Dr. Shema. You can see the share now. Bird
Yes,
fancier.
also, yes, I know,
Yeah,
Dr.
maybe also, yes.
Also, aspergillosis for farmers. I know, I
Okay,
read
but
about
it's not written in the past. It's okay, past medicine. Okay, I will just add one comment. Dr. Sarah covered the whole topic. Just my comment to you, Dr. Shema. Sometimes you are asking question and you assuming the answer. So I guess this way will not be.
No, I don't assume to answer. I asked it again.
Okay, so you don't ask it again.
I asked it again, so I will reply for myself.
So you are replying, yeah. So why you're asking? You are saying you don't
because I
have
have a
bowel
stampa
change, yes?
because I have a stampa and I follow it.
But also, I think for the sexual history and all this history,
Yeah,
irrelevant. So we need. I'm giving advice, but I'm not doing it. But I'm thinking, try to make the history only to the station, not ask about irrelevant things. No need for sexually activities and all these things.
but yeah, sorry, Dr. Sarah. For this case,
as this
it's
patient
important,
have weight loss
relevant,
and
yes.
cataphectic,
HIV, yes.
I should ask about HIV.
Yeah, I agree.
Yes,
HIV here is possible, so she has to ask
and
about.
She asked about the menses, the period. So I don't know this question.
Yeah, this is relevant. Yes,
Yes.
I agree for this. Why you lost the period is not related, but any previous casual relationships, any tattooing, this is relevant for the HIV, as you said. Yes, you're right.
Yes.
And try to be sorry for this question because it's embarrassing question. Don't say
have this
You can
comment.
say, are you sexually active with a stable partner? Any casual partner?
The casual
Yes.
will be sorry. And also, I think the embassy,
You are not
in this
sorry.
case, I have also comment here that she should be more sympathy and empathy, not like
Yes.
making playing role. So try to react more with the patient. Dr. Shima. React more.
Because we are.
If she said something bothering, you will say sorry. Like
Yes,
react.
especially the father story. My father was having cancer. Yeah, what happened to him? Is he okay? Try to do drama for this.
Yes,
Is he okay now? Yes.
Yes, I'm really sorry about that. I appreciate. I can see your worry. So, for me, I'm trying to put
the case is new and good, Dr. Sarah, that we discuss this here because it is not coming to the mind usually.
No, bronchiectasis is one of the important.
Yes, bronchitis, but not allergic pulmonary.
Not allergic pulmonary.
The treatment of allergic bronchopulmonary aspergillosis is steroid and
Itraconazole. Yes,
steroid
exactly.
and antifungal, both.
Itraconazole.
Yes.
Together.
The good comment here, Dr. Shaima, before we move to the communication, that you reach diagnosis. So whenever you said bronchiectasis,
yes,
yes.
Maybe because you missed the
and maybe if Dr. Sarah clarify more the sputum, she will reach. If she clarify about
rusty, I told
she said rusty. Yes, I remember rusty and green.
I didn't know.
I told her rusty, but not
rusty means
because I was thinking that she will think rusty is blood, so I told her rusty, not blood, in order not to think about cancer. So I thought, but I don't know. Okay.
Always the debate make the thing more fixed. So whenever now
This
you
is the
have
first time.
rusty,
This is the first time for me to know the rusty sputum
yes, yes,
means there is that is as ababa. I know rusty
yes.
sputum means bronchiectasis, لكن not ababa.
But brown, it will be also characteristic and more clue for
Characteristic for what? For allergic bronchopulmonary aspergillosis ولا for
the
bronchiectasis؟
brown.
لا ده rusty.
Rusty can be yes as allergic
Characteristic for what?
bronchopulmonary and can be for bronchiectasis. Yes,
Okay.
but
No, but
but
I put for this cause, because you need to know any disease, you need to know the cause. Renal transplant, what is the cause of renal transplant? So I
Yes,
see
yes.
bronchiectasis. That's why I found I can say the yellow nail, I can say other causes, but I think I put I keep saying to you, I have bronchial asthma.
asthma. Yes, I agree for this.
I have
You have
This is
when you ask
information يعني I didn't remember it at all except
Yes.
now when I look it in my notes.
Me too. I didn't know about it, but I'm confused between extrinsic allergic alveolitis and the allergic bronchopulmonary aspergillosis. So I think we know both of them.
yes,
Yes.
yeah,
But
and
you-
the best medicine I shared is very clear and very simple how to
Yes.
differentiate between both.
Okay. Yes.
You can read it now, and inshallah, forever you will never forget. Both information, the etiology, the presentation, and this one will be fibrosis more,
Mm.
is eosinophilic, or
Mm.
sorry, extrinsic pulmonary allergic alveolitis will be more fibrotic, not bronchiectasis. So the pulmonary function test will be restrictive better.
Okay. Yes. Okay.
Yeah.
So
This is a different, and also the exposure here different than here asthma on top of asthma, but in the extrinsic it will be for the fancier, the product of some and farmer, some product from the animal, from birds. It will be like fibrosis, and it's common fibrosis in as a cause of fibrosis, lung fibrosis, extrinsic allergic alveolitis, very common.
yes. So
And it will be occupational clue from the job.
yes. I think yes,
Other,
allergic alveolitis. She will say I have a history with contact with birds,
yes,
so we know this. So it could
uh,
be the long case and can come as a short case bronchiectasis. We'll find
yes,
and occasional wheezes and crepitation is changing with the cough, and they can ask us this question. So now we have
yes,
a good referral for bronchiectasis.
yes, I agree. Also, Dr. Shaima, whenever you have company, exposure to company or working in a company, try to do clarify more to the company. What type of company? Is it chemical one? It might be occupational asthma. Of
Yeah.
course, not in such case, or not in our case, but might be another case coming with uncontrolled asthma. Once you have company, try to clarify the nature of the company. Is it chemical? Is it something producing pollens, or occupational asthma will be one of the
Yes,
differential.
yes,
Okay.
yes. I know this is a bronchiectasis, and I searching about the cause.
Yes,
So I ask about any contact with any pets, any contact with any animal.
yes, yes, and the birds as well.
Because
As well.
I have the information that ababa is
Yes.
due to farmer. Also, I found here now when I search, this is fungi found in soil. And
What? Soil, yes. Farmer, still in
yes,
the farmer, yes.
farmer.
But you
Okay.
said you said the investigation at the end of broncho, but you put it on the lower differential, not on the top. But you did everything well, so you don't need to worry. Okay.
Yes, it's okay. And the appetite also, loss of weight, this is signifying cancer. Once they ask for the concern, put it one of the differential. However, it might be in the lower or whatever, not the order of the differential for the cancer here, but it's still one of the differential. Patient has loss of weight, smoker for a long time, and appetite as well. All this going with the differential as the cancer, okay? Thank you, Dr. Sarah. Nice case. Thank you, Dr. Shema. Well done. Please, if you ask
Thank
for
you,
something,
Dr.
try to put the question or not to ask it again. It will be against you that you are repeating the question.
When I repeat it, I repeat the answer also.
Yes, but they will say you repeat the question. This is comment. Even
We'll to do it by doing more training. You will be better. And
I say you said to me that you don't have kaza because
yeah, with the practice, you will not repeat the question. I believe
yes.
it will be disappear this habit. Whenever you practice more, you will never repeat the question again because you will remember what you asked about. Okay.
Yeah,
Okay. Let's thank you, Dr. Shema and Dr. Sarah again. Let's go to the communication for the sake of the time.
Dr. Sarah.
Dr. Aisha, Dr. Mona.
Yes.
Yeah,
Yeah, who will start first?
What you like, Dr. Mona?
it's okay, Dr. Aisha, no problem.
So I'll give you some scenario first.
It's okay.
Okay.
So she wrote the test for you, Miss Sarah, 30 years, with palpitation, anxiety, and tremors for 3 months. She did blood tests, showed thyrotoxicosis and thyrotoxicase positive. Explain diagnosis and management. Remember the Irish manner, Dr. Aisha, okay? Try to be short as possible.
She's Irish.
We'll start in 2 minutes.
Okay. Dr. Mona, we can say it is Graves' disease. To be clear for you.
Graves? Yeah,
Yeah.
okay. Okay, Dr. Aisha, we can start.
Okay.
Hello, good morning. I'm Dr. Rueni, the doctor in the Grand Clinic today. Am I speaking to Miss Sarah, 30 years old?
Yes, I am doctor.
Miss Sarah, we are here today to discuss some issues related to your health condition. Is that okay with you?
Yes, doctor, sure.
Okay. Miss Sarah, would you like anyone to attend our meeting to support you?
No, doctor, thank you.
Okay. Before we start to be on the same page, would you please tell me how much you know regarding your condition?
I have some problem in my heartbeat, doctor, and it is really causing me like to be nervous all the time. I have some also shaking in hand, and the doctor suggests I have some problem in my gland, and he takes some investigation, some test, and he asked me to come today to know what is the result of this test.
Yeah, I do really appreciate sharing this knowledge with me, Miss Sarah. Sorry for what you are feeling. We are here to help you. I have the result of your blood test. and it showed that you have a condition, Graves' disease. Did you hear about it before?
No, doctor, what's that?
Would you like me to explain for you more about it?
Yes, please, doctor.
Okay. In this condition, Miss Sarah, our gland that present in our neck is hyperactive due to a process called autoimmune, whereas our defensive system start to attack the gland instead of attacking the bugs, and led the gland to secrete more protein called thyroxine. This protein is giving you the whole symptoms that you are suffering from. Are you following me?
Yes, doctor, which gland that you mean?
This is the thyroid gland in front of our neck, that present in our neck, in front of our neck.
But I have no pain,
Okay.
doctor, there.
I do really appreciate your concern. There is no need to have pain. This condition may be painless, uh, but the protein which called thyroxine is high, giving you the symptoms like you have. And this condition also may affect your eyes and your vision.
Yes, you are right,
Uh,
doctor. I have some gritty eye for these months, and I suspect it is from the lenses.
Mrs. Sarah, it may be related to the condition which called the Graves' disease because our defensive system also may attack the eyes instead of attacking the bugs and causing you to have this eye symptom. Also, Graves' disease have some complication. It may affect your heart and make you have some arrhythmias or irregular heartbeats. Are you following
So
me?
what? Yes, doctor. So what we will do, doctor? I'm now very
Uh,
worried about this disease.
I do really appreciate your concern. We will refer you for a group of specialist doctors, the eye doctor, the gland doctor. We will prescribe for you medication to control your symptoms in the form of pills. And also we will prescribe for you medication to control the activity of your gland. Are you following me?
Yes, doctor. Yes, this sounds clear.
Okay.
So for how
Um,
long, doctor, I use this medication?
Uh, Firstly, Ms. Sarah, we will do evaluation of your condition. You may need to use this medication for maybe 1 year, according to the medication that will be decided for your condition. Also, we will need to do a regular follow-up of your eye problems and eye symptoms. You may need to cover them, and you may need to use lubricant for your eyes. Is that clear?
Yes, doctor. Yes.
Do you have any concern, Miss Sarah?
No, thank you, doctor.
Miss Sarah, do you smoke?
No, doctor.
Do you drink much alcohol?
1 minute.
No.
Do you drive?
Yes, doctor.
I would really want from you to stop driving right now until complete assessment of your eye symptoms and to inform the DVLA if you don't mind. Okay, Miss Sarah?
Yes, doctor. Okay.
Miss Sarah, I need to ask you some private questions. Is there any chance, are you married?
Yes, doctor.
Is there any chance to be pregnant or planning for pregnancy?
No, doctor.
Okay, in case you want to get pregnant, your pregnancy should be planned with the woman doctor. As you know, some of the medication that we can prescribe for you not suitable for pregnancy. Okay,
Okay, doctor. Clear.
Miss Miss Sarah, are you financially and socially supported?
Yes, doctor.
Okay.
Do
Time
you
is
have
up.
any other concern? Okay,
Thank you.
thank you.
I will start examining your question, then Dr. Aisha will comment, okay?
Okay.
What's your case about?
Okay. My case was about explanation of Graves' disease and the management of it.
Okay. What do you think about your performance?
I tried to explain the disease and the treatment plan.
Okay. What are the legal issues in this scenario?
Legal. I think no legal issues.
Are you sure?
Maybe verbal consent before starting medication.
Yes. Yeah.
Yeah, it's verbal. Yeah.
Okay. And what are the ethical issues?
Ethical issues are the autonomy that the patient has the right to know everything regarding her condition, sharing in the management plan, beneficence, which means do benefit for the patient, non-malfeasance, not doing harm for the patient, and justice, treat patients equally without any discrimination.
Okay, good. Do you think this patient will take the medication for 1 year only?
I'm not sure. Actually, we need to do complete
Yes.
evaluation of her condition, and then there are many regimens that we can give for her, but at least maybe from 9 to 12 months.
So you can say for a long time, is it?
Yeah, it's better not to decide. Right?
Yes, exactly. So better not to specify the duration. You can say for a long time, and we will assess you from time to time. And what about the
Yeah.
driving? Do you think this patient can drive?
No, I told her to stop driving and inform DVLA until we do complete assessment of her eye condition.
If this patient smoking, does the smoking affect this hair condition, and how?
Yeah, sure. Yeah, sure. Smoking can aggravate the eye symptoms of the Graves' disease, but she told that she is not a smoker.
Excellent. Okay, and do you think this patient having autoimmune?
Sorry?
The pathology of hair Graves, is it
Yeah,
autoimmune, do you think?
it's an autoimmune condition.
Did you tell her? Yes. And yes, yes. You
Yeah,
said it's
I
different
told her, yeah.
syndrome. Yes. Okay. I'm done with the question. Now Dr. Aisha can comment. Thank you, Dr. Mona. Well done.
Okay.
Thank you, Dr. Bassem. Thank you.
Thank you, Dr. Mona. Well done.
Thank you, Dr.
Uh,
Aisha.
Just there is some more point you can draw in the first, so you can have like catch a timing. If you withdraw the thyroid gland and it is here in front of your neck and this be
Actually,
attacked.
I am not sure if Irish, we have a paper and pen in Irish, because someone told
Yes.
me we don't have a paper. We have?
No, yes, you have. I
We
heard
have.
from one colleague, yes, that he took the paper
Yeah.
with him and he drew.
Yeah, okay.
And then from the start, you can also mention this is the gland in front of your neck that is responsible for activity. And it
I
is affect a
said
lot of
actually twice. I said actually twice, but it seemed that you not hearing me well in the first. So you repeated asking me where is the gland. But when I explained, I
maybe
said
the voice sometimes are
yeah,
interrupted from you. Yes.
yeah.
Yeah. So for also the plan of management, there is something other than medication. You can just mention it. Like there is also some things that can we can give you like radioiodine therapy and thyroid surgery. So this is the 3 plan of management of Graves.
Yeah.
Okay, and you can mention also for here we will need another to assess you by some test, some scan to your neck before management. Okay.
Yeah.
Because they just do blood test for hair. So you will tell her because he tell you to discuss the management. So you should discuss that we will need from you some scan to your to the gland. Then we can start the management. If she asks you what you can give to treat me, we will start by medication. So you can control this blood, this heart racing and this tremor or shaking hand. But there is possibilities in treatment you will discuss with the gland doctor. These possibilities can be oral medication and can be some modalities called radio-18 uptake. This substance we give to you and destroys part of the gland. And there is this surgery that we can remove the part of the gland or the gland according to your situation, and this will discuss more clearly after a scan of your gland. Okay.
Yeah.
I know that IIH not have time, so I will not comment on all but I'll just mention this point for all, because in basis we have time and they expect from us to mention more information. Also, this scenario coming 3 times in this year, so I think they putting in mind, and before it's not coming too much. So what is Graves' disease? As you said, it's autoimmune disorder, can cause increase in its like your immune system, affecting or mistakenly attacking the gland in front of your neck. This your neck, there is a small butterfly gland lying here in front of your neck. It is responsible about energy, and its affection can cause affection a lot of organs in your body, like your heart. And by increasing the hormones from this gland, that's causing from you like over energy, like the symptoms you have. Okay, so why I have this disease, doctor? It is like there is family. It can be in familiar, and or it can be associated with other any defect in your defense system in other sites. Well, how this disease will affect me? It can cause. I'm sorry to tell you that it's if not treated, it can cause like problem in your heart, and it can cause problem in your bones, and also it can affect your menstruation and fertility, and also it can affect your vision. Simply, what how you can treat me, doctor? Please give me anything. So first we need to run some scan to your gland, so we can make us more clearly about the problem exactly, and it will also affect the management and the plan we will put after this scan. Okay, what you can manage me, doctor, after the scan? We'll give you some, but before the scan, you will say to her, we will start you right now on medication to improve the symptoms you have till the result of the scan, and then arranging the scan. So this medication is to regulate your heart and also to reduce the shaking of your hand. So if any chance to be pregnant, she will say no. So it is not because it's contraindicated in pregnancy. So after that, you will explain briefly about the management. So after the scan, what we will do, we can give you, there is 3 lines we can manage you. You can take medication. For how long you can be diplomatic? It can be from 1 to 2 years, average. But you can be diplomatic just in answer. This will be a situation according to your response and your condition. We can't expect the how long you should take this medication. Okay, if there's something called anti-thyroid medication, this is oral medication you will take regularly daily to control your gland. This other modality called radioiodine therapy. This is when we inject you with radioactive iodine. This is like radiated material that is causing destroying of part of your gland that is causing increase in the secretion. There is other modality you can make for you surgery if you are not willing to or the first 2 of modalities not suitable for you. So it is 3rd line, and it is if the first 2 line is not suitable for you, or you are with the first two lines, you are not controlled and still have problem, or you are not tolerated the other plan of management. This is all, and you should advise about the eye. I'll give you. So in your role in this meeting, you will advise about the first medication. This is propranolol, and the eye protection. Please, I advise you to try to care of your eye using lubricant. And please, if you find that your eye is not completely closed during sleep, someone tell you like that, please cover it till we can manage you. The third advice here, I'll refer you to the gland doctor and the eye doctor to complete what we will discuss with you today and to complete the management with you. And the social issue, do you need any support? Do you need any, do you smoke? Do you drink alcohol? This is all about scenario.
Yeah, I will add to Dr. Aisha advice. Only when you have such disease, you have a red flag. You can add it at the end. Red flag. Whenever you feel your eyes pumping out, you feel that your heart beats too much extra, or you have sweating, a lot of anxiety. Please don't hesitate to call us and to visit us in the emergency. And you can provide the leaflet brochure about the emergency in thyroid state, like thyroid, hyperthyroid crisis or thyrotoxic crisis, and the eye complication. If you have time, red flags sometimes show the examiner that you are so careful about the patient in the future. So you can put it as red flag at the end and close the meeting with it. Okay?
But the red
Let's
flag
move.
more will be asked about or will be affect your mark if you will discharge the patient or you finish the plan. But if the patient still will come and go to you, so you still manage him. You will not finish. He will not finish now for you. He still have other meeting and other doctors. So maybe I think will not affect there if you not mention.
But Dr. Aisha, in between, the patient might have the symptoms, right? So it might be safe to tell him about or tell her about. Why not? In between the visits, anytime he
Yeah,
has
correct.
these symptoms,
Because crisis is one of the complication of Graves. Yeah, right.
yeah, it might
We
happen
can say
anytime.
in
Yes, maybe yes. Maybe the eye because you will start here already on beta blocker. So I think the eye you should advise also the eye
Yeah,
strictly.
the eye and also the crisis itself. And it will be very impressing to the examiner that you are taking care of the patient even while he's leaving. You are caring for the future. I guess it will be for any disease with flare up, MS, thyrotoxicosis, inflammatory bowel disease, systemic lupus. Why not? You can give this advice at the end of the meeting just to alarm him whenever he feels diabetes, unawareness, hypoglycemia, high blood sugar, DKA. I guess the time or the 2 minutes, if you give this advice, it will be impressive to the examiner. So put it in your mind when you have time. But if supposed to finish your task, finish the task, then if you have sometimes finish the concern, what I do, yeah, you can say it and provide leaflet brochure and provide the contact number. Okay. Thank you, Dr. Nora and Dr. Aisha. Let's move. Yes.
Two questions.
thank you.
Comments.
Yeah.
First of all, why you are asking the examiner question in the communication?
No. This is for Irish madam, not for patients.
I was thinking the other, because I was thinking it's only 10 minutes.
No.
Okay.
Yeah, already.
I think in this scenario, it's important to alarm the patient about the side effect of carbimazole if she develops sore throat and fever,
Yes, you're right. Yes.
cytosis, and this
But
is
no time for this scenario. So this
But-
if you
but this is
Yes.
important, I think, also because the main treatment, if she's not planning to be pregnant, we'll give her the carbimazole.
but you will not start now on here. Still, she will do
Yes.
scan
Yes.
and will the doctor of endocrine the one will
So we
prescribe
will
this
tell her, the
medication.
doctor. I'm sure. I don't know. I will say about examining. But usually
So-
they're telling the patient if you develop any sore throat.
Yes, I agree with you, Dr. Farah, but maybe Maybe it's not specified yet the medication. You just sit with the patient and address the disease and counsel about the starting medication. So it's still not specified, but
But this is
anytime.
really side effects
Yes, of
before the
course, but I agree. But if the medication already mentioned in the scenario, you have to explain the side effect.
okay.
I, I absolutely right. But
Mm.
in this scenario, they didn't give any option yet. They are
Oh,
just giving management the possible plan, the
okay.
disease, the explanation. But once carbimazole or anti-thyroid medication mentioned, and you will give carbimazole, you have definitely you have to warn about any side effect like sore throat or feeling febrile or whatever. Okay, you're right. But in certain situations. Okay, let's move to the next scenario. Dr. Mona, can you write the scenario for Dr. Aisha?
عائشة I want بس from you to repeat the radioactive iodine. How we can explain it to the patient? Only medicine that that destroy a part of the gland.
Yes. It
And
will
simply,
For how
destroy
long?
cells
For how
of
long?
your gland that produce excess thyroid. It is indicated
For,
also in like toxic one adenoma like that. So you just will explain like that. It is some
for how long?
radiating material that we will give you, and it can causing destroying of the part of the gland that causing increase in your thyroid or hormones.
yeah, and you can say also radiation to some chemical. Radiation to some chemical. Iodine is chemical, and radiation is, yes, it's by radiation. It's not um, not only by injection. It might be by injection, but also you can say like that, radioactive iodine. So it's by radiation to chemical that kills the active or hyperactive part of the gland. Okay,
Mhm.
let's read the scenario, Dr. Aisha, for you. You can read it.
Where here?
Yeah, in the message, candidate information, Miss Bridget Harvey, 31 years, has been admitted with blurred vision. On admission, it was noticed that she had bilateral papilledema and subsequent enhanced CT scan of the head found to be normal. The most likely diagnosis as benign intracranial hypertension, and the consultant neurologist has asked for lumbar puncture with the measurement of the CSS pressure and if raised for therapeutic aspiration. Your task is to explain the in a straightforward and uh, terms, anyway, benign intracranial hypertension and encourage her to consent to lumbar puncture. Okay, 2 minutes, then we'll start.
Okay.
So, idiopathic intracranial hypertension for CSF for LP. You ready?
Yes.
Yeah. Here you go.
Okay. Hello. I am Dr. Mtwali, the Senior House Officer in Emergency today. May I confirm you are Miss Harvey, 31 years?
Yes, doctor, I am.
Okay, Miss Harvey, how do you feel today?
I have doctor blurred vision actually, and started 3 weeks ago, and I'm not comfortable at all, and I have some headaches also.
I'm sorry for you, Miss Harvey. We are here today to discuss about this health condition for you, and I'll inform you about what is going on with you. But let me know how much you know about your health condition from coming to hospital. After coming to hospital.
As I told you, doctor, I was complaining 3 weeks ago from headache and blurring of vision, and I came to the hospital. They do some scans, and I'm here today to know what is going with me and what is the result.
Okay. I'm sorry for what happened to you, and Miss Harvey, and I'll try to help you by discussing what is the result of the scan. So let me please to be symbolize the issue for you, to draw for you something. This your brain, and there is some covering of our brain, have some fluid, so can protect our brain from any like any movement, sudden movement. And this
Sorry,
fluid,
doctor. You told me what is the result of the scan? What do I have?
yes, I'm trying to tell you now.
Okay.
I am explaining to you. Okay.
What is the disease that you are explaining for me?
Okay, it is called, we expect from the scan from you, it's come normal, that we didn't find something in your scan, but from examining the back of your eye, we found some changes that suggest some diagnosis. And this is the diagnosis we suspect. It's called benign intracranial hypertension. Do you ever heard about this term?
Oh, doctor, it's cancer?
I really appreciate your worries, but it's not a cancer. I'll explain if you let me to you what is this disease exactly. It is from term, it is benign, so it is not very dangerous disease, and it can be treated, and you can back to in most people you can back to normal situation and normal health. So our brain have some fluid around it, and this fluid is important for us. But in some situation, your body making this fluid too much, or he eliminate from this fluid less. So this fluid become more and pressing on areas in your brain, and specifically it is the weak area, and it is behind the eye. So it affects your vision. Is this sound clear, Miss Harvey?
Yeah, doctor, but I'm afraid though I will lose my vision, doctor.
I really appreciate your worries, and I reassure you in most of cases, if it is like catch it early and we treat it early, your vision will back to normal in most of cases.
Okay.
Okay, Miss Harvey. So about what we suspect, we should make confirmation about this diagnosis. So our consultant decide for you some procedure we should do to confirm what we expect and to start management. And fortunately, that this test also can be part of the treatment for you. Can I explain you this procedure?
Yes, doctor.
Okay, this procedure is called lumbar puncture. And don't bother you about this name, and I'll explain you what this procedure. This procedure, when we will take some fluid from your back, this fluid that covering your brain and the cord in the back, we will take some sample from it. Is this okay, Miss Harvey, till now?
How will you take this sample, doctor?
Okay, we will admit you first, and we will make sure that you are not taking any blood thinning medication. Then, in a specialized team, they will make you on side, lying in a bed on side, comfortable, and giving some numbing material in your lower back. And in your lower back, we will introduce some needle that will get some fluid, and it can take minutes to finish this procedure. And after that, we can give you some analgesic or painkiller, so to be comfortable, and you will lie to bed for some times, for some hours, and we will closely follow up you for any problem after this procedure. And for this procedure, well done under complete hygienic condition. Is this sound clear, Ms. Harvey?
No, doctor, I have needle phobia. Do anything except putting needle in my back. I don't want.
I really appreciate your worries, Ms. Harvey, and I know how this feel like bad for you and this hard situation. I really advise you about this procedure because it can treat you, and it's the only way we can diagnose your condition.
No alternative, doctor.
I'm sorry to tell you this is the only way we can diagnose this condition, and the benefit also from this procedure can treat you by reducing the pressure on your brain. And about your needle phobia, we can handle this by giving you something to be not completely aware and to be in sleep during this procedure if you need. This is sound
I
good.
will think, doctor. I will think about the matter, doctor.
Okay, I appreciate your concern, and yes, it is your right. And just I need from you to know also about the other unwanted effect of this procedure, so you can giving all the information about this.
Okay.
Okay, for this, for any procedure, because as anything in medicine, it have good effect and unwanted effect that we can't expect. But with the clever team and the very professional team, it is very minimal, and we didn't face in our hospital. This back unwanted effect is like some bleeding or some uh, uh, bug, and also failure of the procedure, and some headache that can come after the procedure. But don't worry, we can manage IIH of this problem, and it is
So
rare,
many.
except the headache, and we can manage it if happen to you. And by clever team and by precaution, I reassure you that is minimal to happen this problem with this procedure. Is this sound clear, Ms. Harvey?
Clear, doctor.
Okay, Ms. Harvey, I need to ask you what you do for living.
I'm a teacher.
Okay, and do you need any support regarding to your job about these conditions that affect you?
Yeah, doctor, my vision is hindering me from doing my duties.
Okay, I'll help you by referring to occupational health workers. They can also give you some sick leave, and also advise about this problem. Any help at home to you, Miss Harvey?
I live with my family, doctor.
Okay, do you need any support at home?
Thank you.
Okay, do you drive, Miss Harvey?
Yes.
I really advise you to stop driving right now and inform the PLA about your condition, and we will assist you further to see if you can, is the time you can back to driving, because it is very harm to you and the others.
Okay.
Okay, Miss Harvey. So about information we talk, it is a lot. So I'll give you some brochure about we talk about, and really you will think about this procedure in near future. And I can arrange another meeting to explain more And if you are accepted, you need to sign some paper called consent to contain all the information we tell you about, and you can sign it, and anytime you can stopping us from this procedure also, even if you sign this consent.
Okay,
Is
time
this
is
okay,
up.
Miss Harvey?
Okay, doctor.
Okay.
Yeah, time is up. Okay, let's hear the comment from Dr. Mona.
You did very well, actually, Dr. Aisha. I just have one comment. I see it's better when we have the result. We say the name of the disease first, and then we explain the condition. Because she has a concern that she is afraid it's a cancer. You started directly to explain the condition without telling her that her CT scan is normal and her diagnosis is benign intracranial hypertension. And then you can start to explain the disease as you exactly did.
Okay.
After that, yeah. After that, you did very great when you draw for her and you told her this is procedure in her best interest decided by our consultant. And the good news that this procedure could be diagnostic and therapeutic in the same time. But also you forget to tell her that we may need it many times because we may need to, if the 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 pressure inside your brain is high, we may need to take this fluid out, and we may need to do this procedure many times. She may refuse because of doing this many times, and she asked for alternatives. You may say for her that we will first do for diagnosis, and if the pressure is high, we may give you some medication that may lower the pressure inside your brain, and also you may need to lose some weight, and these measures may help. And as
Yes,
you
you are
did,
right.
of course, yeah, as you did also, you explained for her the complications of the condition, and this was great. She said that she will consider thinking about the procedure, and you give her leaflets and brochures and websites for supporting and helping her to think about this, and this was great also. And you asked her from the driving issue that you should stop driving, and this was great also. I don't have any other comments. Yeah, you actually did very well. Thank you, Dr. Aisha.
Thank you. But I need just where I'll put the other information because I have a problem, I think, in management time. Uh, maybe I
First,
talking in one point more like that. So I
yeah,
need this
first of
comment
all,
really.
yeah, you have two tasks. You should first explain the result of the scan, and this is what she is waiting for. You started to explain directly without telling for her that it's normal, it's abnormal, what is the diagnosis she has. And this is important for her because one of her concerns is cancer.
Yeah.
After that, there is no need to explain more. You just may say the fluid that present inside our brain and around our cord is increasing and making pressure on the back of your eyes, and that's it. No need, and gives the symptoms that you have, and no need for more explanation about this because you still have another topic, which is a procedure. And when we explain a procedure, we first tell the name of the procedure. After that, we will tell the steps of the procedure. Um, you also started to explain the procedure without telling me the steps that you will insert first needle because I have needle phobia. You should start the steps and saying we will start needle like uh, in order. It's better.
I
But
said it
you
in order.
covered. You informed me that we will do this procedure to take a fluid from your pack, and you didn't tell me that you will insert needle first. I told you how will you take this fluid, doctor, if you remember.
Because I just explain the procedure first, then I'll explain the step. Mm. Okay.
Yeah. Yeah. You
يعني
explain
I
the
explained
steps.
what meant by the procedure, and then I'll explain the
Yeah.
steps.
You can do them once, not to take much time. You explain the procedure while you are telling her the steps, and this will be clear
Mhm.
because you are summarize for her that this procedure is diagnostic and therapeutic in the same time. So you can say the steps at first, not to repeat the information and to save the time.
Okay.
That's it, but you did very well actually.
Okay, thank you for the case, Dr. Ramona, and comment.
Yeah, thank you,
Thank you,
Dr. Noor, for the
Dr. Aisha.
case. Thank you.
Thank you.
Yeah, well done, Dr. Aisha. The good thing in all scenarios in communication, you are so calm, sympathetic, and empathetic. But I want to add for the needle phobia, you can reassure her it's very small needle. Sometimes you will not feel it. Our patient, they are not feeling it. Why? Because we
No,
are
Yeah.
they can't. They feel
introducing
it more.
yes, they will. Yes, try to reassure,
Sorry
but
for interruption, Dr. Bassem.
yes,
Yeah, regarding this point, you will say for her the only pain that you will feel is
yeah,
while we are numbing the skin around
yes.
the area that
But
we will
it is not
insert the
true.
needle.
It's not true. It will
We
No,
will
feel.
no,
lie.
there are.
We will lie on her. We will
No, no,
Yes,
lie
no,
on
but
her.
no,
that's
there is
not true
numbness.
information. It will reduce the pain, but she
Dr.
will feel
Aisha,
by every step of lumbar, because I did this many times, lumbar puncture.
She
You
will
will
feel the
feel,
pressure, Dr. Aisha, not the
not the
pain. She will
pressure,
feel the
not then,
pressure.
not even the
you
pressure.
feel
You will feel
something,
the pain. Yes, yes, you
Dr.
will have
Aisha.
a pain.
Yes, you will feel, but
Yeah.
it's not that much. Yes, for
Yes,
you,
I
of
tell
course.
her it is not that
Yes,
much, and you
You are a
example.
doctor
but
and you are
Yeah.
feel, Dr. Aish, you are a doctor, and if you are doing a procedure, you are feel by your inner heart because you are
yes,
knowing that there is
yes,
pain
yeah,
here, but the lay people know
yes,
they may feel
exactly.
some pressure and some
Exactly.
discomfort,
Some
some
discomfort or
discomfort.
something
Yeah,
going inside you, but try to reassure
yeah, not
because
pain.
she is not a
Yeah,
doctor. Yes, exactly.
yeah,
And the
yeah.
communication you did great for everything.
Okay, so
Uh,
I'll say to her it is minimal pain. You will, but she has phobia.
yes,
Phobia not related to pain. Phobia not
Dr.
related.
Aisha,
If
that's
she
why.
has blood extraction, she has phobia. She said, if she will say, I fear from pain, I feel pain, I reassure like that. It's a very fine needle and you will not
Yeah,
feel
yeah,
pain.
right.
But
You can tell
phobia,
her that
it's
we
not
will
related to the
choose.
size or the pain.
No,
Even you can
you
reassure.
you 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 can reassure her that you will choose for her a small needle, and also there will be a nurse present to check on her and monitor her if any discomfort happen for her. We will interfere directly. Just
I
reassurance
think
for
a small
her that
needle, we will
yes,
choose small needle, not Petro, but
yeah,
I'll tell it is a small needle, like that, even it's not
Yes,
small.
this is
Okay,
yeah, this is an
this is
important issue.
reassurance. Yeah,
Yeah,
yes, okay, you're right.
reassurance, even you are feeling that yes, and real, yes, but you have to reassure because you have to get consent from this patient, whatever
But also, I
the
attend the lumbar
situation.
puncture for many times. It's really not
Yeah,
not like
we
that, not
agree.
easy as you said.
We agree for all this, but this is communication, sir. How to convince the patient?
Yes,
You are not here to give her scary more from the needle.
and
So you have to
patient
mention small.
experience are different actually, Dr. Aisha.
Yes, exactly.
It's different experience from one to one.
no.
Yeah.
Also,
Especially
I
doctors are
I
bad patients.
no.
Doctors
I
are bad
attend
patients.
this for other patients. I attend the lumbar puncture for many patients, really, and it is like not.
Dr. Aisha, we
Yes,
are putting
okay.
medication, right? We are putting local analgesia. So this is the first precaution. We are taking our precaution. We are applying numbness medication, painkiller. Also, you can tell her after the procedure and before the procedure to be sure that you are not feeling the same pain while you are not taking this medication. Okay?
Okay. Yes, okay.
Just try to convince. This is my point.
We should tell her about the side effect and communication. One
said
of them
yes.
is a headache.
She said yes.
Yes,
She
I
said.
told. I
Yeah,
told.
Yeah,
she
she said.
said already. She said, yeah.
Yeah.
She said
I,
you may need to lie on your back for many hours to minimize the chance of having headache. Yeah, she said.
yes. I guess this is the consent also here is crucial, as you said. I have comment for Dr. Mona for the previous scenario. When you give disease, you have to give silence, you know, the result.
Yeah, golden silence. Yeah,
Yeah,
I stopped for a while. Yeah.
yeah, right. Because you said you have a disease called thyrotoxosis, and immediately, so you can give
I said you
some,
have a disease called Graves' disease and stop for a
yeah,
while. Maybe it was short.
yes, you're right, yes.
Yeah.
And the breaking bad news if something is very dangerous in any scenario.
Yeah.
Yeah,
Yeah.
okay.
Cancer or yeah.
Okay, yes. Again, sorry, I mixed between two scenarios. So again, advice for Dr. Aisha, the reduction of the weight, medication, and not to take any medication without seeking medical advice because some medication can lead to increase or worse of
I
the
need
pressure.
advice about the time. How I just catch the time at the end. I don't know what is wrong with
Believe
me,
me,
but
Dr. Aisha, some things you might do and you be like impressing because some others will not remember
yes,
these
I
points.
know you are right. But
Okay,
I asking you
manage your
to
time, and
advise
if you
me
can
how
do,
to
Don't
manage this. Yes, I
if you
really
can
need
do,
advice.
don't repeat information, Dr. Aisha. Yeah.
yes, I agree.
Don't repeat information, okay? And try to short the explanation
Yes,
to the point only. If you said benign intracranial pressure, you have a fluid around our brain and our cord, and it seems that the pressure inside your brain is high and it affecting the back of your eye, giving your symptoms that you have. That's it. No need for more explanation about this. And then the other point, the procedure name, the steps, you will lie on your left side and we will numb the area. We will introduce a needle and then we will take some of fluid and measure the pressure. If it's high, we will draw more fluid. We may need to repeat this again. Just stuck to the main points. No more details.
Mhm.
This
by
will
the way,
save the
Dr.
time for you.
Yeah, by the way, Dr. Mona, they are putting the patient in sitting, not in lateral or left.
Sitting.
Sitting,
No,
yes.
I read it in
No,
the
no, lateral.
left position, in the left
No,
lateral
lateral.
position.
No, should lateral,
Yeah.
yes.
Why should? It's elective, right?
Yes, but it is the procedure done like that because there is like something you will measure the pressure by, and it is the patient should be comfortable. You will take time to finish. It's not
All right.
anesthesia. It's not
I
spinal anesthesia.
yeah, okay,
The
maybe for
spinal
the
anesthesia
anesthesia.
that it will be on
Yes,
sitting.
yes, maybe yes,
But
you're
this
right.
is a procedure you should
Yes, yes.
make the patient
Okay,
comfortable because
I
it will
agree.
take time.
Okay, better to say we'll put you in a proper position, whatever the position.
Yes, yes, yes. You are right.
Okay,
You're right. But lumbar
Yeah.
puncture always on lateral side. Yeah, it may be right or left according to the
whatever,
any.
yes, whatever. Yes.
Yes, but it is on lateral. Mm.
Okay,
So
thank you,
if
doctor.
you set the main points, you will save time. No
Yes,
more
sure.
details.
Yes,
Yes.
I'll try to do this again. This scenario. Okay.
Yeah.
Okay, any other question?
Regarding name, Dr. Basim, now don't say benign intracranial hypertension. It's idiopathic intracranial hypertension because it is not benign. And either the candidate tells the surrogate, as from name, it is benign, it is not cancer.
The scenario said it's benign
Yeah, whatever.
intracranial
Yeah,
hypertension.
this is what also
but
supposed.
now it is
According to what's
idiopathic.
written.
But because it is benign, it is not benign. Even at this
Yeah, I
mention,
know.
I think more than
Yes, you're right. Idiopathic intracranial hypertension now. But if written there in the scenario, so we have to follow the scenario. Simply, it was written in the scenario. But you're right. You're right. I agree with you. But if written
in the previous scenario,
Yeah, maybe
explanation
this
of
scenario is old before changing
it's old,
the
yes. It's old, yes.
Yeah.
Yes, you're right, Dr.
so
Khalid. Yes.
this may be irritate the examiner. Another point, when in the previous scenario when he said radioiodine, we inject dye. No, radioiodine, I think it is capsule, right, Dr. Basim? It is
Capsule.
capsule and will give us
there is oral form. Yes, there is oral form, and there is also
capsule
injection
and
form.
will give the patient to swallow. And thank you.
Yeah, there is two forms.
Is
and I will try
radioiodine is different from Lugel's iodine, or they are the same?
let's clarify it in the WhatsApp group. I will read it. I will read about it, then I will share it. But I remember there is capsule. Yes, it's oral medication.
And they are the same? Lugel's iodine is the same with
No,
radioiodine?
I'm not sure, but radioactive, I think different. Let's read it. Yeah, we'll not go through now.
I think that you told Victoria, it is used in I think in cytotoxic
In
crisis
the
or something
crisis,
like that.
yeah, it's
Yes,
used in
In the
the
crisis.
crisis, yeah.
Yes, you're right.
But I mean,
Right.
it's different from the radioiodine, or they
I
are the
guess
same?
maybe different because we are reading it only in the crisis, but the other one is for the long term. Anyway, we will try to clarify it by some search, and we will update it in the group. Okay. Thank you,
Okay,
Dr.
thank
Khalid,
you.
for your comment. Thank you, Dr. Mona, Dr. Aisha. Thank you all. We'll see you tomorrow. inshallah. Any other question before
It
ending
is
the
by
session?
mouse, yes, by mouse as
No.
capsule or liquid.
Okay.
Okay.
Okay. Thank you, Dr. Aisha. Any other comment, any question before ending?
No,
We'll see you
thank
tomorrow,
you.
inshallah. Thank you too.
It's fine.
Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
I think,